Hi, this is Dr. Dale, and this is Natural Health Radio. We're having a mic fix here at the top of the show, but that's just what happens in live radio. So welcome to Natural Health Radio. My name is Dr. Teresa Dale, and I am here today to share with you a lot of educational information about your health, about your emotions, about what's in the news, about the latest information that you need in order to have a healthy life. And as you know, every Tuesday at 1 o'clock, I am here. I think last week, a couple of weeks ago, I couldn't be here, so I'll always send a little note to you and let you know. But we are here to share with you information about mind, body, spirit healing, and staying totally natural, staying in the place where traditional medicine, except for emergency care, is almost not necessary. And in order to deal with your body from that level, you need to have some education in your body. But what you do need is to trust your feelings. So when you have a feeling that your body is not functioning correctly because of a certain reason, whether you fell or you're just depressed or whatever it is. So what you need to do then is listen to your feelings and trust your feelings. And this is something that should not be overlooked. In other words, if you go to a health provider and they tell you X about your health and you feel that does not resonate with you, then say it. Say it and just make sure that everything resonates with you. Okay, because a lot of health providers today use computerized medicine where the machine is testing energetically, perhaps your body, your acupuncture points, and perhaps it's somewhat accurate, but perhaps it's not completely accurate. One thing the machine doesn't test is the absolute cause of the disease, and if the priority is to deal with structure or body chemistry or electromagnetic, which electromagnetic is emotions, radiation, from EMF, EMR, nuclear, or X-rays, or radiation therapy in cancer. So we have those three modes. Those are called body modes. So those three modes give us an opportunity to see what is a priority and where to start with the body. Okay, because it's very important to start in the right place. Otherwise, things don't hold. So whether you're dealing with subluxations, they don't hold unless you do the right thing, handle the right thing first, the priority first, and then deal with the subluxation. Because things don't hold when you don't find the priority of treatment out. Okay. So the other thing is when you're offered a traditional medication, what you need to do is to find out from your doctor or from another source, could be us, could be someone else, but find out from investigative detective work what naturally could be used instead. Like, what is the purpose of the medication? What are the side effects of the medication? And how do you do it naturally? I can assure you, you can do most things, and if not all things, naturally. Okay. Now, if you're in the emergency room, that's one thing. Okay. You got to go with what is. But when you get out, then you can start engaging with a individual who can help you to make decisions related to how long you're expected to be on the drugs and find out, what's the expected timeline of needing them and how to clean up your body so you won't need as many to help you to get off of it. You got to cleanse your body and detoxify your body. Let me give you an example. let's say you have a structural issue. Let's say that that your body is very toxic and you keep going in for structural adjustments, but they don't hold. It could very well be all the toxins that are in your vertebrae, that are in your blood, that are in your muscles, that are, around the vertebrae and the fascia. Those need to be detoxified in order for the adjustment to hold. Okay, that's the key. Now, if you're if you're on statin drugs, I'm not saying get off to drugs. I can't tell you that legally. What I can tell you is to educate yourself to see if you can find a replacement for it, a natural replacement. Homeopathic medicine, if you're talking about statin drugs, you can use homeopathic medicine. You can also use herbs, vitamins, minerals, many different things to achieve the purpose to lower lipids, cholesterol, and all of that. That's very, very easy to do naturally and requires no drugs. Okay, but I'm not telling you to stop your drugs. I'm saying it again. Okay, it's illegal for me to tell you that. What I'm telling you to do is to become educated so you can make new choices. So that's pretty clear. We want to make choices that do not have side effects, because the side effects affect our emotions, the way we feel about life, the way we interact with people, our energy levels. And we want to make sure that as we get well, everything gets well. From the medications, some things can get worse. And those are the things I'm talking to you about. Your emotions, your moods, your endocrine system, your hot flashes, everything can get worse from medication. What I'm saying is that do your due diligence, do your homework, investigate formulas that you can use as an alternative, as an option. Now, you can go to my shopping cart, drdaleswellnessstore.com, and you can see there all of the little buttons. There's a button for pain. There's a button for wellness, women's wellness. There's a button for male wellness. There's a button for many different things. And you can see things that are used to achieve that goal. But this is coming from a place of working with thousands and thousands and thousands of people, so that we know that that natural medicine works. It just depends on the formula. It depends on if you're cleansing. You have to cleanse the body if you've been on any medications. So cleansing, you can find that on my website. I have organic cleanses there's no glyphosate in them. There's no toxins in them. And no magnesium stearate. Everything is in veggie caps. So you're really good to go with those. And we have phenomenal success from our doctors and outpatient clinic of hospital. So we need to get you over there to get some information. Also, whatever's going on with your body, whether it's hormones or emotions, you need to cleanse. Number one, as a foundation. And by doing that, many symptoms just get up and leave because you're cleansing your body. And so those negative toxins that are there will no longer affect your mind, your sleep, your emotions. It will not affect it. So you need to cleanse as a priority. We have 2 cleanses. I suggest you read them both and see which ones feel good to you. The other thing is detoxifying vaccines. Many people have talked about this. Homeopathy is used everywhere in the world, not only to detoxify vaccines, but also as a prophylactically as a vaccine. So one of the things that you could do is learn more about that. And if you know someone or yourself who had a bad reaction to a vaccine of any kind, then you can read more about this in our membership area, which is at wellnesscenter.net, and you click on membership or members, and then you can become a member and become educated. So for $20 a month, you can become educated and learn about protocols to use for a variety of different conditions. I think the main thing is to empower you to educate yourself and understand that you are smart. You know your body better than anyone. You're the perfect person to determine and be a detective to find out what to use. That's natural. Okay. So your choices are using homeopathic medicine or using herbal medicine or using nutraceuticals, minerals, vitamins, and sometimes using all of those together in a special protocol. In the members area, I offer protocols for people who want to learn to help themselves. And so I feel that this is a phenomenal opportunity for you to really learn about your body and for you to make new choices. You know, it would be great if you could go to the doctor and you go to a medical doctor, and if they would say, you know, you have a choice. You can take this drug, or you can take homeopathic medicine, or you can take herbs, and here's your choices. But you know, that's kind of living in a fantasy world, because today most medical doctors do not do that. They drug, and they don't give you options. It's up to you to come out with the options, and you do that through education. And I'm getting some notes. Thank you very much. And I appreciate that. I will try to get to that in this show or in the next show. What we have available in this amazing world today is the internet. Through the internet, you can find out anything about anyone, and you can find out anything about your symptoms. You can go to a homeopathic website like homeoint.org. You can put in your symptoms and see what remedies come out. You can buy a homeopathic materia medica. I would definitely buy one by Borke to start with, Boericke. I would definitely get that and look up your symptoms there. You'll find out the remedies to use. And also, what you need to do is to get a hold of some protocols that can help you. You need to look up your symptoms related to what can help them online, okay? Your education can be so amazing by going to the right places online. Now, if you want more detailed information, if you want to become a clinical nutritionist or a homeopathic medical practitioner or a naturopathic practitioner perhaps, you can go to our college, which is www.traditionalnaturopathy.com. traditionalnaturopathy.com. We have a new website. It's awesome. You should go check it out. Check out our courses. And these courses that I mentioned are online, and they require reading, and they required you're doing work online within the training itself, and you get testing for each module. The school is state licensed since 1995. And we are in good standing with the state, so we are a state licensed college. And that would be a good place to, if you want to further your education and help others and really get a handle on healthcare in general. But if, let's say you don't want to do that, you just want to know for yourself, then I would become a member of the Wellness Center, and then you can email me, you can make an appointment with me, and maybe more importantly, you can educate yourself in the members area. You will have your own dashboard, you will have access to protocols, education, audios, videos, teleseminars, and just so much material. So that is where all the educational material is. And from that perspective, you will learn so much about your body. Now, when you're trying to heal yourself, the specific diet that you use is very important. Let me give you these cute little clues. If you have joint issues, you need to eliminate all meat and dairy, because animal products are an inflammatory food. So they will inflame whatever's already inflamed. They will make it worse. You need to, instead of eating that, you need to substitute with all kinds of vegetables. If it's joints, you want to eliminate root vegetables. You know, root vegetables like carrots and potatoes and daikon and radish, even though daikon radish is great for your digestive system. If there were joint pain, I would say to eliminate all root vegetables. And then just eat vegetables that grow above the ground, which are vegetables that grow, anything above the ground, okay? So root vegetables you want to avoid if there's joint pain. Yes. And also you want to avoid any animal products completely, because they are an inflammatory food, okay? The idea of taking whey, WHEY, for your immune system is kind of absurd. There's so many better ways to do it, because whey is a dairy product. Dairy products are not good for joints, okay? Not good for a lot of things, but I would eliminate any whey or any products that have dairy in it. And if you want a good protein powder, pick hemp protein, maybe mixed with some pea protein, PEA, so that you will get more protein per serving. And boy, it's very satisfying and delicious today. You can get great vegetarian protein powder. So we're talking, for you, those of you just came in, we're talking about joint issues, a diet for joint issues. There's a diet for many different conditions. So if you had another condition, let's say you were iron deficient, okay, then I would say to eat small amounts of animal protein, okay, but no dairy. Okay, so every condition is slightly different. The thing to remember is you need to find the glycemic index. You can do that on our website. You can also search for the glycemic index online and see which foods are the lowest in sugar. Okay, the lowest ones are less reactive if you have diabetes or a blood sugar issue. So you want to eat foods that are very low on the glycemic scale. Okay, and it'll surprise you as to which ones are higher and which ones are lower. I would get that index. You can go to glycemic index and find that on the internet. That is one thing. So we have to make sure that when we're having health issues that we eliminate sugar completely. So now monk fruit is delicious and that tastes like sugar. Coconut sugar is delicious, tastes like sugar. Stevia doesn't taste that much like sugar, but in small, tiny amounts mixed with other sugars that I'm mentioning, it tastes good. So the diet for heart disease would be different from other diets. The diet for high cholesterol would be different, okay? And so you have to consider when you're using a diet that it's not, that one size doesn't fit all. A weight loss diet doesn't fit all. One weight loss diet will work on one person and not on another. But then again, It's because one diet doesn't fit all. We need to take into consideration everything about the patient's health. And at that point, we need to customize a diet and a protocol for achieving the diet and any nutritional products that have to be taken along with your diet, your food. Now, it's really using food as medicine, and I really like that idea because it's what I do and it's really true. So, in other words, let me take something so simple like your body's hydration. In other words, if you walk around dehydrated because you're not drinking enough water, then at that point, and you have that realization, you need to really start drinking about 2 liters of water a day, but you can augment it with fruit that will help hydration, like organic grapes. For an example, organic grapes can actually help hydration. And sometimes eating raw grapes will be so healthy for your body, and it just depends on the person, but you've got to drink 2 liters of water a day. I mean, there's no way getting around that. That's something that we need for our body's hydration. And if we don't do that, then we can have various symptoms from that. You can pass out from that. You can have so many different health issues from that, including problems with your kidneys, which is your lower back. So if you have a lower back problem, please look at the amount of water you're drinking and hydrate, okay? And because that can help in a day. And your back pain will be less, and that will teach you something. Your body will teach you, hey, you drink more water, your back pain is less. That means that you're dehydrated. So very easy to do is get involved with your day and get involved with the kids and all the things you love to do, and forget about yourself and forget about drinking water, okay? Now, tea, juices, and other things are not water. I'm talking about 2 liters of pure, clean water a day, okay? Juice doesn't make up for that. Green juices don't make up for that. Fruit juices don't make up for that. I don't care if it's juice fresh or how it is, you have to drink water, because that's our cleansing, our body's natural cleansing and detoxification methods that it needs. We also want to share with you that many times, and I have this happen with clients who come in and have, let's say, they had an accident, they hurt their hip. I'm thinking of someone very specific. It was a sporting accident, and this person got hit by a tennis ball in the hip. 70 miles an hour, whatever it was going. And it created a problem. And in that problem, they wanted to do surgery, and they put a plate in there. And then there was all kinds of problems because of the plate. There was biofilm on the plate in the body, and we had to detoxify that. Plus, you have to understand, when there's an injury, the memory of that injury is in your body on a cellular level. Therefore, when I see someone, I help them through a process. We remove the memory, the longevity of that, and the memory itself completely from the body, so that the body doesn't go back to that injury and recreate those things again. That's how things become recreated, because no one's handling or helping you get rid of the memory of that traumatic event, physical or emotional, okay? So in this case of this patient I'm talking about, I helped her release all of the emotional issues and identities that were related to this injury, because this person is a tennis pro, right? So then what happens is things get better and better for this person, and they had their plate in their hip removed because it was so much better. And then we just continued to heal the tissue and normalize everything. And work, see if there's any other emotions, and work with the diet. Diet is very important. I mean, there's many things that are a key. One is finding the cause, the right diet, detoxification, and a protocol that addresses exactly what your issue is, so that you're not taking any more than what you need. In supplements, you're taking exactly what you need, and that you know the time period that you're taking it for before you leave the office. So you can work with many health issues yourself through education. And this is part of empowering yourself. I mean, I can tell you how empowered you are and how awesome you are and how you can do all of things, because I know that's true. But you may be sitting there going, oh, she got to be kidding. I can't do this, or I can't learn this, or I've tried and it didn't work. And see, all of those negatives go against what you want to do. So what you want to do is have an identity, or a affirmation, if you like, that is something like this: I am brilliant and can learn anything I want to learn to help my body. Okay? So that means it needs to be your mantra, because it's true. And the only problem is if you don't think that's true. That's the only problem. That's the problem itself. If you don't do this, is that you don't think you can do it. You don't think that you're able to do it. And I'm telling you that I have helped people who we didn't even speak the same language to become empowered to learn about their body and to heal their body. So we know that you are capable of doing this. You may need a team player to guide you, to help educate you, and you can get that through our members area and make an appointment with me if that's what you want to do. And then, you can feel more confident that you have a team, somebody on your team that you trust, that you that can give you the absolute on what you can and can't do. Pretty much you can do anything. You just have to learn. Let's say your mental and emotional issues, those are going to be best healed by using homeopathic medicine. But which homeopathic medicine? Okay? What remedy? What formula? And this is why you can go to drdaleswellnessstore.com and click on emotional release, and you could see all the things there that you would use for emotional release that work according to the 5-element theory of Chinese medicine and the body clock and homeopathy. It's a beautiful combination of both, so that it works to balance the organs, glands, emotions, and the formulas are been around since 1991, and they work. So there's so many things we can do if we only just knew about them. So this is why you're on the show today. You're on the show today to listening today and on Facebook Live today to find something out for yourself or a loved one or a child or your pet. Whatever it is, we need to know that anything is possible. I just don't believe that things are incurable. I've never seen that. What I've seen is that if the detective work is good, you'll find out how to do it. So I would practice your detective work. You can become a member. You can look online and you can determine what is best for your body. Remember, the diet for different things, for different issues, is going to be different. So if a person has digestive issues, I'm going to give them a completely different diet. Most of the patients that I see, I eliminate gluten. It's all organic, and it's non-dairy, and it's no animal products when they're ill or if they have an inflammatory condition. And there is an aspect to every disease that has, there's an inflammatory part, a component to every disease, just like there's an emotional component to every disease. Okay, and you need to address both of those. Also, one of the chief things could be that candida isn't going away because you have mercury fillings in your mouth. It won't go away if you have mercury fillings in your mouth. The candida lives on the mercury, and it inspires candida to keep going because it affects you. The mercury affects your immune system. So, there is a lot to learn, but that's what we're doing here today, and I'm giving you options so that you can help yourself and your family. Many people who have children cave in just to keep thinking they're keeping them happy. They give them the chocolate, they give them the sugar, because otherwise they'll scream or they'll misbehave or whatever. So you need to get some good help with that because I can tell you that when kids are no longer eating sugar, they don't misbehave as much. Okay. And you have to eliminate the sugar. So you want to eliminate cane sugar. You want to use things or bake cookies with monk fruit, coconut sugar, stevia. Okay. Those I have found after so much experimentation that those not only taste the best, but there are the low glycemic options for sugar. Okay. Evaporated organic cane sugar is high glycemic. Okay. It's sugar. Even though it's organic, it's still sugar. Even though it's evaporated cane, it's still sugar. Okay. And it will react that way in the body. So in order to eliminate that, we need the monk fruit, the coconut sugar, and the stevia. So sugar affects every condition there is. So if you're saying, well, what about having arterial plaque? How does sugar affect that? Sugar affects that because it attracts the glycoprotein, attracts all of the calcification and helps create the hardening of the arteries. Okay, now a lot of people who have hardening of the arteries want to, they're told that they have to do a bypass, a double, triple, quadruple bypass. Okay, so to avoid that, you need to make sure that you're not eating dairy, deep fried foods. Okay. Some people if you've been to any of these carnivals, like the state fairs, right? You've seen like deep fried butter. I mean, people buy it and eat it. Deep fried butter. I mean, the thing is, these people, I don't know if they want to be educated or if anybody's ever helped them to understand how many calories, where the fat goes, and the deep fried thing, and there's a coating on the outside that has sugar in it. This is like a heart attack waiting to happen, right? So you need to know that arterial plaque is caused from your diet, and that is eating sugar. And also from eating too much protein, fried foods, many different things and animal fat will contribute to that. Therefore, I want to suggest something to you, that if you're worried about arterial plaque, if you're worried about your arteries, you need to go to get a Lifeline screening. It's in communities, neighborhoods. Usually they have it at a church or a community center. Nurses are there, and they test every artery in your body, every vein in your body. check your lipids, take your blood pressure. Okay, for all of that work, you just go in there, you make an appointment, you go in there, and it's like $147 for the whole thing. One of the best things on the planet to do, because it can tell you how your arteries are. And if it's showing any blockages, then you just need to change your diet and to start chelating your body. Chelation is the process of eliminating the calcification in the arteries. And that can be done by IV very effectively, but you need a lot of them to do that. And just letting you know, it's expensive. And then you can also do it orally, which doesn't work that well because you have to digest it, and it doesn't work as well. But orally is one way, oral chelation. And the other way is rectal suppositories. That works a little bit better. So chelation, there's 3 ways to do it that are effective. Those are the 3 ways that chelate the calcification from your arteries. You also need to take ionic magnesium, because ionic magnesium will help to the decalcification process. So you've got 4 things that I shared with you now about hardening of the arteries. First of all, get your arteries and all the vascular system tested, lifeline screening. Okay, and that is, I don't make any money on that. You just look them up, go to your community. For $147, you have the whole thing done. Nurses are there, and they just give you a report, and when you're done, and then you know what you are for your age. You know, like for your age, they give you the determination and the analysis according to your age. Now, what I like to do is like go in and say, can you do this like I'm 20 years younger than I am? And let's see what what it shows then as a research project. So I know if my arteries are clear and they're using an age that's 20 years younger than me, I know I'm doing pretty good, right? Because some people, when they're in their 50s, 60s, 70s, that's when the arterial plaque starts building up. Okay, so that's why they want to look at your age and they go, oh, person 60, they should have some arterial plaque. Well, no, you shouldn't have any arterial plaque. So what I'm saying is, if it shows anything, you need to get on a program to detoxify it and release it and change your diet. Like no bacon. Bacon, pig meat, all of the animal fats are very bad. And then you have butter and dairy products, very bad. What you need to be on is either a vegan diet, or if you prefer your food steamed, then go to a macrobiotic diet, but remove all of there's way too many grains in a macro diet. They use rice, brown rice, that's good, but way too many. So much of the diet is grain based, and I would like it, and it depends on the way it's taught, but it should be vegetable based with a little bit of grains, unless you're grain free. Okay, which is fine, but a little bit of grains certainly won't hurt. It won't hurt you a bit. You can use red rice. If you've ever had red rice, it's Thai red rice, yummy, or purple rice, also yummy. You can get that at the organic in the health food store, and you could try a little bit of that. I think grains really create some digestive issues for people, and depending upon the person, I would, first the person should really think about their gut, right? And then you want to go on a total elimination diet. You want to do vegan diet, no grains. right? No animal products, no grains. And let's see how quickly you can feel better, maybe a week. And that'll teach you, okay, my body does good. Now I can start adding things back to see which things start affecting me in a negative way. That's the long way to do it. So, if you go to a provider that I've trained or myself, we do that and tell you what to do in 10 minutes and what's good for you, what's not good for you. I mean, other than doing it the long way. So we only have about 10 minutes left. What I'd like to do now is to take you over to the California College of Natural Medicine. I'd like to just tell you that you can get a tour of this website by calling us at 800-421-5027, and we'll be happy to show you around that website. We have a new website. We have some courses are residential in person, and others are completely online. And you should just take a look, because we have a lot of health providers taking them as well as entry-level people. We need you in our United States and other countries. We need you using and helping people with natural medicine, because God knows there's a lot of people who want it and need it. There's oftentimes a shortage in certain states and certain cities. There's a shortage of people who do natural medicine. People can't find anyone. So if you would consider helping others through educating yourself, that would be an awesome thing to do. We have a few minutes left. What, about 10 minutes? Yeah. Okay, 8 minutes. So one of the important things, besides my staying on time, which is always very important, we need to understand that there's so many things happening in our USA, in the United States today, related to health, related to so many things, that it can cause confusion. Meditation can cause stability. One of the things that many people are confused about is that herpes, HSV1, is now considered a cause of Alzheimer's disease. So herpes can sit on the nervous system, and they're showing a direct effect to the cause of Alzheimer's disease. However, what they're not telling you is the whole thing. Herpes will leave your body if you have your mercury fillings out. You can take a homeopathic remedy for it and eliminate it, okay? In order to get herpes, let's say herpes is in your brain, you can take a homeopathic remedy for it. You can open up that pathway to your brain, the hepatic glutathione pathway, which is liver mediated, and the homeopathic medicine will help eliminate the herpes. And also, what I just said will help Alzheimer's. There's Alzheimer's protocols that you can get, which are nutritional and homeopathic based. This is what you want to look at. You want to look the way to do things naturally, because it has no side effects. Why wouldn't anyone want that? I know that's why you're on there today. And as I'm looking right now, you're looking for a certain protocol, as I'm reading right now. Sorry to get right up so close, but I don't exactly understand the question from Richard. But protocols can be found that work in our members area, and unless you have something very specific, that you could always go into the members area and make an appointment with me for that type of a nutritional homeopathic cleansing protocol. And every condition has something that's so specific that if it's forgotten, it won't work as well. And so that is just something I want to remind you of, is to make sure when you get a protocol that it includes homeopathic medicine, vitamins, herbs. You're dealing with emotions in every case. You are dealing with getting the mercury out of your mouth in every case. Okay, so we need to move in the direction to do positive things as soon as possible. And this is the way things are helped. No matter what your diagnosis is, diagnoses can be wrong. And I can give you an example of one. I'll do that next week of myself. I'll give you an example of one next week. And because it's right now, it's a little bit too late to do that. But even information that comes from an EEG for a brain scan, it depends on the equipment that's used. It could be wrong. It could be misleading. The machine could be reading the data incorrectly, could be an old database. So I'm going to go into that more next week and talk to you about all of the testing that you have done or have had done, and tell you what to look out for. Because testing, even blood testing, there's optimal reference ranges. Okay? You wouldn't know that unless you were a member. And in my membership, you get an optimal reference range chart. So we tell you the right numbers for all the tests. Okay? That's so helpful. And all you need to do is to go in there, check it out, and get your blood test done, which you can go get without going to a doctor. You can go to wellnesscenter.net. At the very top, you'll see products. Hover over that. Go down to the bottom where it says order blood tests. You can order the comprehensive wellness panel. It's 51 biochemical tests, $97. I negotiated that down probably 60 to 70% for you. And you can order your own blood tests, pay for it yourself. And you'll see all the blood tests there. You can choose the one. You can read about them. You can, just go from what I'm saying. You can be a member, ask me more about it. But you need to order it on your own. And then what they do is they send you a little requisition form showing that it's paid. You pay for it yourself. You go into a lab in your neighborhood, and then they send you the results. You are the one that's paying for the test. You get the results. Then you choose if you want to have somebody help you with it or create a program. Then you can choose who you want to do that. So I feel that this is all part of empowerment. Today, we have that opportunity of having the internet. And not that everything on the internet is correct by any means, but the places that I can send you to review things, you will read them and learn about them and find out information that can help you. 2 minutes left. Okay, so one of the things I want to recommend is going to Webscape or WebMD. You can go in there and check out a vitamin or try to find out more about a nutritional product, something, or about a condition, and you will see abstracts. You will see abstracts that you can read through. But in many cases, some of that information can be life-changing and effective and really something you need to read. And then again, on the other hand, if you read it and it doesn't feel right, then don't do it. Don't use it. Just have to judge it for yourself. Go with your feelings. And as you become a member, you'll get a lot more educated as to how to get help with this. I want to just say with you, we have a minute left in that time. I want to thank you so much for being on the show today. Wish you all my love and blessings. You're going to have a great holiday. Make it great. Just see what you want to happen in your holiday and make it so. And until next Tuesday at 1 o'clock. I want to wish you an awesome week. Make it the best you can ever make it, and have a terrific time and lots of fun. Take care, and that's it for now. Natural Health Radio, Dr. Teresa Dale. Many blessings to you. Bye-bye.